Welcome to your PWC Connections, a monthly look at Fayetteville's hometown utility, the Public Works Commission of the City of Fayetteville. I'm your host, Wendy Riddle. There are so many wonderful organizations that serve the needs of our community. One of those is Better Health of Cumberland County. Today, in Community Connections, we'll learn about this group that provides for the unmet health care needs of our residents through assistance, referral, and education. They can only do that through your generous support, so they'll also tell you what's in store for this year's annual fundraiser. Here at PWC, we also serve the needs of our community by bringing you the safest and best tasting water in North Carolina. In today's Inside PWC, we'll tell you everything you need to know about an annual change required by the state to our water treatment disinfection process. After that, winter is in full effect, which means you need to take extra care of your pipes. Hear from an expert in our Conservation Corner who has a few tips that'll keep your plumbing in tip-top shape, which in turn will save you time and money. And in today's Greenway, the city of Fayetteville is going green. Learn how you can take advantage of the city's first electric car charging station. You'll get a charge out of it. All that and Gabby too, so stay tuned.
We're very proud that Better Health was founded in 1958, 54 years ago now, in Cumberland County by ordinary citizens who had a concern. And their concern was that the poor were leaving the hospital without the ability to buy what the doctor had prescribed for them. And this could be prescriptions for the most part, but it could also be medical supplies or medical equipment. So these concerned citizens, among them a doctor and a nurse, but otherwise just folks that had a concern for the needy, founded Better Health based on a model at that time in Durham, another organization, which is no longer in operation. The original premise of Better Health was just that specific assistance for prescriptions and medical supplies and medical equipment. Now, 54 years later, we are still doing that, but we've also expanded into other services. To get assistance, though, for these needs, you do have to qualify by income and household size. This is the only program we have that does require income qualification. However, we also offer many services to any resident of Cumberland County. We're probably best known for diabetes management services. Anyone in Cumberland County on a Tuesday morning or a Thursday evening can come in who is diabetic or who might suspect that they're diabetic, get their blood sugar, blood pressure, and weight checked, and talk to a nurse. While they're here, there will be a short education session going on if they wish to listen to it for about 30 minutes. This is unique in the county. I know that I could not call my doctor's office and get in same day if I had a concern. So this is an opportunity for anyone with diabetes to do that, or anyone who wants to be screened for diabetes or blood pressure problems. When you do know you have diabetes, it's a very overwhelming diagnosis. So we offer a complete management class, self-management. It's a 7-week course, everything you need to know from A to Z about diabetes. Ideally, someone would take advantage of this when they're first diagnosed, but oftentimes people come in after they've been diagnosed for many years, but they know they're not taking good care of themselves. We have very good outcomes with these programs. Our clients show great results if they want to work the program and achieve health goals that make themselves healthier and their doctors happier and healthier with them. We also have a program that takes advantage of all the unused and unneeded medical equipment around the county. If you have at home, for example, a wheelchair that perhaps was used by one of your family members and is no longer needed, you could donate it to Better Health. And then we could lend it out to someone in need. It's a very simple concept, donation and then lending. And this is also open to anyone who lives in Cumberland County, regardless of income. We have people who borrow things because they need them for short-term use. We have people who borrow things because they're not sure yet exactly what type of equipment they want to buy. And then, of course, we have a lot of folks who borrow things because they can't afford the medical equipment and don't have insurance to cover it. So we really enjoy this program and very fulfilling to a lot of people in the county. Better Health is a United Way partner agency, and we have been since 1959 after our first year of opening. But the rest of our income comes from other generous pockets in Cumberland County. Most of the time do not get any state funding. We do not get any federal funding. We have some county funding. But the vast majority of our income comes from either donations to United Way, donations to a church, individual donations, and some business sponsorships. And so we are very pleased that the county has been so generous and supportive for so many years to support just this neighbor helping neighbor concept that we use here. A few years ago, after we've been offering diabetes services for many years, we started thinking about prevention because, of course, prevention is always the best strategy to take in health matters. And we found a state-produced program that we could get at no cost called Eat Smart, Move More. And so now we offer this program around the community. This is a program that is presented in groups outside our building. A church is our most common place that we present it, but we could offer it at civic groups, churches, any group that's interested in improving their health. Eat Smart, Move More is not a certain diet, it's not an exercise program, it's just simple solutions to achieve a healthy weight and thus a healthy lifestyle and better health indicators. The program is in 4 parts: Eat Smart at Home, Eat Smart on the Run, Move More Every Day, Everywhere, and Move More, Watch Less, which of course is reducing screen time. We've been doing this for 5 years. We've expanded it into an Eat Smart, Move More Kids program as well, where we go out to kids' summer camps or kids groups such as Boys and Girls Club and present the program to them as well, and have found the children to be exceptionally receptive to this kind of information. We have one signature fundraiser every year at Better Health, an evening at the theater. This is our 15th year for doing evening at the theater, and it has evolved over the years. We started off showing a classic movie on the big screen and having a reception. But today, of course, movies are so readily available. About 5 years ago, we decided we'd go in a different direction. And this is our 6th live musical show this year that we're producing. And every year they've been produced by Cassandra Valerie, one of our local theater talents that many of you have seen perform at the Cape Fear Regional Theater. And she puts together a musical show, a little dance, a little humor, a little drama, and it is always terribly entertaining and fun. We have this event at Highland Country Club, and this year our theme is A Touch of Class, an elegant evening at the theater. And it will again be at Highland Country Club, and there'll be good food and good drink and fun and conversation as well as the show. The tickets are $175 for a couple or $100 per person. We have many wonderful corporate sponsors for this event. We literally could not put it on without them. There's no printed ticket, but reservations can be purchased here at Better Health or from any of our board members as a contact or liaison. We always offer the option of a donation to Better Health if you can't come. The invitation that goes out, there's a return card that offers that option. And of course, we're always really happy to accept the donations here. Our website also has an opportunity for general donations or purchase of tickets for evening at the theater or a donation to evening at the theater. You can also find out a lot about what we do at our website. It tells all of the programs that I've just described and more. And on the homepage, it always has whatever's going on right now, and there you will find more information about evening at the theater. Most nonprofits could not exist without volunteers, and Better Health is no exception to that. We use volunteers in a number of different areas, from something as simple as labeling our newsletters that we send out to the community, or we use a volunteer as a receptionist at our clinics every Tuesday morning and Thursday evening. We also use volunteers to teach our diabetes classes. The way that we can afford to offer these professional level classes and of a medical nature is to have professional volunteers that come in the evening, such as doctors, nurses, dietitians, pharmacists, and so forth like that. We could not afford to put all these people on staff, and so we have wonderful volunteers in the community that come in and do that for us. So there are a lot of different types of volunteer opportunities, and we do have a volunteer application very simple to fill out. And if someone would like to volunteer, it probably is best to make a phone call first and chat a moment, and then we like for the volunteers to come in and have a look around and see what we do. And then we can find where the best fit is for them to volunteer. At Better Health, we would like to become not the best kept secret in town. After 54 years, there's still many people that don't know what we do here at Better Health. So one of our major goals every year when we're setting our goals is more community awareness. So we hope that this program will increase that awareness among the residents of Cumberland County. both those who need our services and those who are willing to help us offer those services.